Okay, so today we want to talk about diabetes and hemoglobin A1c and glucose monitoring. What do you think if your hemoglobin A1c is 7 and your fasting blood sugar is 150? Are you doing okay or not? And so let's talk about that. So the hemoglobin A1c is a measurement of the amount of red cells in your blood that have glucose on them. So hemoglobin is a molecule that is circulating in the bloodstream. The red blood cells are full of hemoglobin, and they then have a associated glucose related molecule, which is on this red blood cell, which lasts about 120 days in your body and gives us this measurement that we have come to become our gold standard for diabetes control, called the hemoglobin A1c. And the hemoglobin A1c is measured every 3 months because that's essentially the lifespan of a hemoglobin molecule. And in that time frame, one gets an average of one's blood sugar. The reason why it's so important in diabetes management is because all of the clinical research studies that have looked at control and the complications of diabetes are related to the measurement of hemoglobin A1c. So when we were all of these studies looking at type 2 diabetes, type 1 diabetes, different types of medications, different types of treatment, whether if you were on type 1 diabetes, whether you were on a pump or not, all these clinical research studies use the hemoglobin A1c as the measurement of whether or not control was achieved. And so one then could look at the measurement of whether a patient was controlled with a hemoglobin A1c as compared to uncontrolled, and whether or not the complications were worse in one or the other. And most all of these studies showed that hemoglobin A1cs at a certain level gave us the protection, so to speak, or gave us a lessening of the likelihood of a complication of diabetes. So that's what really the hemoglobin A1c is about, is it's trying to look at whether or not one's going to develop the complications of diabetes. And those complications include eye disease, retinopathy, kidney disease, nephropathy, or disease of the peripheral feet, which is called neuropathy. And then, of course, we are all aware that diabetes increases the risk of heart disease. And so, again, these measurements of hemoglobin A1c are looking at trying to maintain the likelihood that one would not have complications, assuming that their hemoglobin A1c was in a certain range. And so that's why hemoglobin A1c is important. That's why we measure it, and we look for levels that are in the 7 or below range in certain individuals. So hemoglobin A1c in a younger person who is otherwise healthy might be somewhere the goal might be less than 7, even as low as 6.5. But in an older individual, because of the potential risk of hypoglycemia and other complications, the hemoglobin A1c may be able to be higher and therefore be as protective in that case. It's very individualistic based upon the patient's age and clinical situation, meaning there are other medical problems. And so looking at that in relationship to, for instance, a finger stick, is really looking at an average over time and the ability to really have a documentation of a level that really tells you whether you're making progress in relationship to control versus an individual finger stick, which is just a point in time. And one's blood sugar can change rapidly or slowly depending upon what you're doing, whether you're eating, whether you're exercising, whether you have an infection. Blood sugars will go up and down on a very routine and very quick basis. But the hemoglobin A1c, that really gives you this idea of what's going on over time. So those two things are important, and I think they function in different ways in trying to tell us about the control of diabetes in individuals with both type 1 and type 2 diabetes. So just to give you an illustration of another way of looking at this, it would be like having a grade point average that someone is in school and has their GPA over a period of several months or years versus a pop quiz where you get a score on a individual test or an individual quiz. Those two things still have importance, but there may be more significance depending upon the situation for one versus another. So it's just another way of kind of looking at whether or not a hemoglobin, what the difference is and the similarities between a hemoglobin A1c and a individual blood sugar. If you need help with type 2 diabetes, reach out to North Texas Endocrine Center, and we'd be glad to see you and help you with your diabetes care.